my name is Theo Mthethwa. I'm a social worker here at Tara.
Hi, my name is Paula. I'm a student social worker. So, Theo,
Yes.
when looking at substance abuse and addiction, a family member or a teacher who starts to notice that their child or their students are using drugs, a lot of questions go through their mind. Things like, what can I do to help? Or how do I really know that they're using drugs? Or maybe should I be more strict? What are your thoughts on this?
So, I think as a parent or a teacher, you often have concerns for your child's emotional well-being and physical well-being. And part of that, it's hard to think what is it that you can do. But my recommendation, I think first it's important to seek a professional help where you'll get help to learn about addiction as much as you can. And that will enable you to understand how you can support your child.
And why do you think adolescents use drugs?
There are a number of reasons why adolescents are using drugs, and it is important to take into consideration the individual factors, peers factors, family factors, and community factors. So, for instance, within the individual factors could be some sort of personal trait that kind of like influence substance abuse behavior. And then within the family, sometimes we are looking at like family conflict. Parents must co-parent, must think as a unity. And then maybe we are looking also and within the school environment. Sometimes we find that the rules are not clear, and then there is accessibility of the substances. It goes again within the community level where substances and alcohol are easily accessible, and then there's no as well clear rules within that context.
So it seems that there's a lot of risk factors that can cause adolescents to do drugs. But now what we need to worry about is addiction. So what exactly is addiction?
Well, addiction is a chronic and relapsing brain disease despite harmful consequences. So often, for instance, when I talk about harmful consequences, someone, if he or she has not reached their rock bottom, it's hard to quit. For instance, they can be arrested, or they can involve in mob justice, but they can still continue to use. So such people are classified as people who are addicted. Despite harmful consequences, they continue to engage in substance abuse behavior.
So it sounds to me that these adolescents who do drugs don't really care of the outcomes because it's a brain disease. So now, as a parent or a teacher, what can we do?
Well, first, it's important, as I said earlier, that when you seek a professional help to learn as much as you can about the addiction, it's important to set clear boundaries and limits. Do not engage someone whom is under influence of substances. Wait for them when they are sober and address the issue. So it's important as much as it's hard, but the reality is we cannot force someone to quit drugs if they are not ready. So what you can do as a parent or as a teacher is to seek help for yourself, protect yourself, your well-being. There are different resources that can help you and your child. Firstly, we are looking at outpatient treatment centers, which includes Sanka and other NGOs that specialize with addiction. And then secondly, we have inpatient treatment centers. These include rehabilitation centers, and their program differ from each other. For instance, accommodates patients for 21 days, 6 weeks, and 3 months. And then thirdly, we have Alcohol Anonymous and Narcotic anonymous. So this and ongoing support as a sort of form of aftercare where it helps your child to maintain sobriety after recovery. And then lastly, we have church-based services. Often church form as a support system to ensure that someone who is fighting for addiction, they ensure that they overcome through getting support from church. Thank you for listening. For more information, there's a link below.